Hey runners, my name is Katharine and I'm a physiotherapist working with Central Health Physiotherapy in London. I'm a runner myself, so I've got a keen interest in running related injuries, and I'm delighted to be here with you today as part of Run Through's Move It May campaign talking about Achilles tendinopathy. In this short video, I'm going to talk about Achilles tendinopathy, what it is, the causes, how we treat it and what you can do to help, and whether or not you should continue to run. First up, what is Achilles tendinopathy? Achilles tendinopathy is the term that we use to describe pain coming from the Achilles tendon. People experience pain either in the mid portion of the tendon, which is called mid-portion tendinopathy, or at its insertion into the heel bone, which is called insertional tendinopathy. The tendon becomes sensitized to load, meaning certain activities such as running, jumping, and even walking can become painful. The pain usually improves when you stop doing certain activities such as running, but frequently returns once you resume these activities if you do not address the sensitivity within the tendon. Exercise is key to addressing sensitivity in the tendon, and we'll talk more about this in a moment. What causes Achilles tendinopathy? So Achilles tendinopathy occurs when we repeatedly load a tendon beyond what the tendons are capable of tolerating. This usually happens when there's a sudden change in how we load the tendon. That can be a sudden increase in mileage, it can be a sudden increase in frequency and as a result reduced rest days, or a sudden change in the type of training that we're doing, so introducing a lot of hill work or introducing a lot of speed work. It can also occur, however, if you suddenly get back into running after a period of time that you weren't running and you don't gradually reintroduce your miles. There are a number of other factors such as age, weight, and health conditions that might increase your risk of developing Achilles tendinopathy, but generally it comes down to some sort of training error. One of the questions that we get asked most frequently is, will this get better? Well, the good news is that Achilles tendinopathy generally responds really well to a period of rehab. Studies have shown that regular strengthening exercise can improve the tendon's ability to tolerate load. Treatment usually involves a short period of reduced running while we introduce strengthening exercises for the calf complex. We then gradually reintroduce running while we continue to progress calf strength and improve overall tendon load tolerance. What exercises should I do? So, like I said, regular strength training has been shown to improve the tendon's ability to tolerate loads. Achilles rehab focuses primarily on the two main muscles of the calf, the gastroc and the soleus. However, it's always advisable to do exercises for the main muscle groups of the lower limb, including the glutes, the quads, and the hamstrings. Some of my favourite exercises for the glutes, the quads, and the hamstrings include squats, lunges, step-ups, single leg squats, and Bulgarian split squats. And we'll go through some exercises for the calf now. So I feel like I should start by clarifying that these are not my legs. A single leg heel raise is an exercise that I quite like to give to strengthen the gastroc and to load the Achilles. I often get people to stand on one leg and to hold on to something so they're not having to focus on balance and they can focus on the strengthening aspect of the exercise. Then I get people to push through the toes to lift the heel and slowly lower the heel to the ground again. We're looking for 6 seconds time under tension here, so 3 seconds up and 3 seconds down. The exercise can be progressed by asking someone to add some weight, either by holding onto a dumbbell or by wearing a backpack filled with bottles of water, books, or even bags of rice. And then the exercise can be regressed by asking someone to place the other foot back on the ground and pushing through the toes on both feet to lift the heels. For the Soleus, I quite like a bent knee heel raise. So I usually ask the patient to stand on one leg, bend the knee about 30 degrees, and from there push through the toes to lift the heel. Again, we're looking at time under tension of 6 seconds. So I normally recommend to lift for 3 and lower for 3. As with the straight leg heel raise, you can of course progress this by adding weight. Or you could regress it by placing the other foot back on the ground and turning it into a double leg heel raise. Aim to complete 12 to 16 reps with good technique. If you're able to complete 16 plus reps, then it's probably worth considering progressing the exercise, either by moving to a single leg variation or by adding some weight. Aim to complete 3 to 4 sets of each exercise with 1 to 2 minute rest between each set. And aim to complete these exercises 3 times per week with rest days in between. So the all-important question, can I continue to run or should I rest? It really depends on the individual. However, where possible, we do encourage runners to keep running, but there's a few things that you should take into consideration first. Consider how much running you can do before you start to develop symptoms, and try to stick with runs of this distance or this duration, or even slightly less, for a week or 2 weeks while your symptoms settle. Aim to take 1 or even 2 rest days between run days to allow time for the tendon to recover. If things like hill work or speed work are exacerbating your symptoms, then avoid these to begin with. And once you're back running and you're running without much pain, you can start to think about reintroducing these sessions, but aim for 1, maximum 2 sessions of speed work per week. When you do start to increase your running, think about trying to increase your total weekly mileage by 10% per week. And finally, if your pain is severe, like 6 or 7 plus out of 10, or if you're experiencing pain at rest, then I usually recommend that you do take a break from running for 1, maybe 2 weeks while your symptoms settle, while the pain comes under control, before you start to think about reintroducing running. Programs like the Couch to 5K program are a fantastic way to give your reintroduction to running structure and to gradually build up tolerance within the Achilles tendon. When can I expect to see improvement? So with Achilles tendinopathy, it can take time for things to resolve completely. Sometimes it can take up to 12 weeks to start to notice real significant change. To settle the pain, think about reducing your running to comfortable levels and aim to keep your running at those manageable levels. That is, running with pain of no more than 3 out of 10 and no lasting pain after running or no pain the next day. Continue working on building strength and load tolerance within the calf. And if despite all that things are not improving or things are getting worse, then it might be best to check in with a physiotherapist just to ensure that you've got an accurate diagnosis and they can help to guide you the best way possible through your rehab. To summarise, Achilles tendinopathy is a really common presentation in runners, but it is treatable. It usually comes from doing too much too soon. So have a look through your training diary and try to reduce your training, either the volume, the frequency, or perhaps the intensity, to allow the symptoms time to settle. Exercise is key to help reduce sensitivity in the tendon and improve load tolerance. So exercises that strengthen the calf, such as heel raise, bent knee heel raise, seated heel raise, are all fantastic options for improving load tolerance within the Achilles tendon. Once you're going with these exercises and your symptoms are under control, you can start to think about reintroducing running. However, remember, no more than 10% per week. Finally, if things are not getting better, or if things are getting worse, or even if you just have some questions, it's always worth checking in with a physiotherapist who can ensure the diagnosis is accurate and then give you a tailored rehab program that's going to best meet your needs and get you back running. That's all from me, guys. See you soon.